Hello everyone. So today we will be studying about breech presentation and face and brow presenting part. These topics are not so important, but still we are studying because you all requested me to make a list and of breech maneuver and all the images concerned it. Okay, so I can't refuse your wish. So I am here with the whole breech presentation and face and brow presenting part. Okay, so we will be starting here, but before starting, once again I request you to please like, share and subscribe my channel. It will encourage me a lot, and it will help me a lot in my teaching journey. Okay, so I'm overwhelmed today with the response of my students in INS set. Hoping best for you also. Let's start it. So first here is Aina said November 20 question. Okay, a lady presented in labor in with a breech presentation. Okay, so lady has presented in labor with breech presentation. False is. Okay, so this is Aina said November 20 question. So in the last 5 years of AIMS and INSET exam, only one question come and this was it. Okay, so that is why I say the topics which are quite less often asked, you study them but study less often. Okay, for breech, continuous fetal heart rate monitoring is done for the mother. For any patient in labor, we do continuous fetal heart rate monitoring, right? It is one of the point on the partograph. Okay, breech identified for the first time is contraindicated for normal delivery. No, it is not that the first time breech is contraindicated. If we want to do, we can do breech delivery even for the primary gravidas. Though no doubt, it's a myth. This myth is going on in the air that primary breech is an indication of cesarean. It's not like that. Okay, so just to finish that myth, this question I think have been created in INSET November 20. Next question is breech delivery in hospital. Breech delivery is done in hospital where emergency cesarean facility available. Yes, because once the head gets struck or we get any problem in the breech delivery, then we have to do that. Okay, we have to do the emergency cesarean done in presence of expert obstetrician who is familiar with the breech delivery. Yes, obstetrician should be very familiar with the breech delivery. Okay, so the answer, they have asked us the false statement. The false statement is breech identified for the first time is contraindicated for normal delivery. So this was one question, and here we will start the breech management. Okay, so first of all, what is breech presentation? You all know presentation is what is felt in the lower part of the uterus, and if buttocks are felt in the lower part of the uterus, it means that it is a breech presentation. Okay, and what is its management? If you are getting breech in the lower part of the uterus, first, as I already explained you in the transverse lie, also here also I will explain you that the breech or the transfer or any problem in presentation or lie or presenting part, so you if that part has not engaged itself, then the chances are there. For example, if head is extended or there is transverse lie, here is breech presentation, if all these findings are before the engagement of the fetus lower part of the uterus, then there are chances that it can rotate. Okay, so if it is a breech at 30 weeks, then it doesn't mean that it will continue be in the breech presentation at 37 weeks also. Okay, so once it is breech at 36 weeks, 36 completed week, there are less chances that now the breech will turn into cephalic. So at this time we do ECV, external cephalic version, at 36 completed week, that it is a ideal time. And as I already explained you in the question also, that primary breech, it is not that we will go to we will go for cesarean. And for to conduct a breech normal vaginal delivery, two things are must. One is that there should be a trained obstetrician who is well equipped with all the breech maneuvers, and number two is that emergency cesarean facility should be available in the hospital you are conducting. So here I would like to tell you there are three types of breech delivery. One is breech extraction. What does breech extraction means? You are continuous pulling and pushing. Once you saw the buttocks at the perineum and you keep on pulling, extracting, पूरा अपना जोर लगाई जा रहे हो, ठीक है, that is breech extraction, and it's very bad. And then on the other hand, there is spontaneous breech delivery. You didn't touch and hold the baby, comma came out. You didn't touch. So both are opposite. Extraction, you are pulling and pushing from the first time you saw the buttocks in the perineum. And spontaneous breaches is you didn't touch and the whole baby get delivered. And what is breech assisted vaginal delivery? That you will this is the most preferable mode, and it is usually done for the live fetuses. Okay, the other two are for the IUDs. Okay, and this breech assisted vaginal delivery is for breech assisted vaginal delivery is for the live breech. So it is the most good and most recommended delivery for the breech presentation. Okay, and what are the principles of breech assisted vaginal delivery? You are not going to touch the fetus until and unless the umbilicus is delivered, and no, you are not going to push from up, and not you are going to pull from down. Okay, so no pushing and pulling and no touching before the umbilicus is delivered. Okay, now your favorite topic, the maneuvers of the breech. So entrap for the because you know all that in the breech assisted delivery is most recommended, and usually the whole portion of the fetus get delivered and the head gets entrapped. So for the entrapped head, there are some maneuvers. Out of three maneuvers are there, and best is delivering the head or pulling the head with the help of Piper's forceps. Here you have to learn the name, that the forceps of the breech is a very long forceps, and it is known as Piper's forceps. Okay, so you can see the diagram also. Sometimes they ask you diagram. The other method by which you can deliver the entrapped head is burn marshal. What is burn marshal? So you can see here that the baby head has got entrapped here. In the number one, the baby head has got entrapped, and then in the number two, we let the baby hang at its neck, and we catch hold the baby fetus from the ankle, and then we rotate the fetus in a C-shape arc. Okay, so what is the burn marshal method? Burn marshal say methods is that you will let the baby hang for few seconds, and then you will rotate the baby in a C-shaped manner up till the mother abdomen, and thereby the head gets delivered. Okay, so this is the second method, and number third is the Mauritius Malay white technique. Okay, Mauritius Malay white technique. What is it basically? Basically it is for the entrapped head only, last technique. And here we give the malar flexion. As you can see here, they are giving the malar flexion. Here malar flexion is being given. They are flexing the this malar joint, flexing the malar joint, and they are simultaneously with the other hand they are giving the shoulder traction. Okay, so out of this, best is the Piper's forceps. Okay, and these are some three maneuvers, more maneuvers. The first maneuver is for Yes, the first maneuver is love set technique. Love set technique is for extended arms. Just see in the camera, usually the arm is flexed, but sometimes the arm is like this in the breech presentation. For the extended arms, it is the love set maneuver. Okay, so here we rotate the baby at 180 degree, and thereby the stuck arm get released. If the interior arm yes, thereby when we rotate the baby 180 degree, usually the interior arm gets stuck below the pubis, and when we rotate it by 180 degree, the interior arms becomes the posterior arm, and the baby gets delivered. Okay, so it is rotating the baby. You just need to learn the arms and just need to know a little. For example, in the burn Marshall method, you need to know that we are rotating the baby in a C-shaped direction, in an arc. Okay, and in the Marshall smell weight technique, you should know that there is malar flexion and shoulder traction and Piper's forceps. These are the three methods for the head. And for love set, you should know that extended arm. How you will come to know that love set is for extended arms? So the love gets set when hugs, right? So you can say that in the arms there is hugging, so love sets. Okay, and extended leg is for the extended leg, it is the Pinard's maneuver, where we put pressure in the popliteal fossa. Here you can say the doctor is, or the obstetrician is putting the two fingers here in the popliteal fossa, and thereby the extended legs, they get delivered. Okay, they become flexed. Okay, this is a method for the extended legs. Pinards, P for popliteal and P for pinards. Next is the, for the buttocks is a groin traction, to let the deliver. So you all know that in the, with the one index finger we put the finger between the, at the thigh joint, and we deliver the buttocks, so that is groin traction. So as you all know, in the breech assisted vaginal delivery, we don't touch the fetus till umbilicus is delivered. So pinards and groin traction is for the breech extracted delivery. Okay, extraction, breech extraction, in which we, from the right first moment, we are pulling. Okay, so this was in short about all the maneuvers on one slide. Piper's forceps, burn Marshall, in which we were rotating in the C shape. It looks very embarrassing when we see that. That is why I always tell that the C shape, how one can rotate a fetus in a C shape manner. Okay, so it is a gives a heart burning. That is why burn Marshall. Mauritius Malay white techniques. It just contain a name smile. Smile is with malar flexion. Okay, malar flexion and shoulder traction in this. Arms, I already told you, for extended arms it is love set. Love gets set in arms. Legs is pinard, P for popliteal fossa and P for pinard. For buttocks it is groin traction. You all know that buttocks are near the groin. Okay, true about the Frank breach. This is a FNG question which has one comes in 5 years. Only once it has come in 5 years. Okay, what is it? Most that Frank breach is mostly associated with congenital anomalies. Footling presentation, ECV done after 34 weeks is best, and has hip extended and knee flexed. So Frank breach is the most common breach. What happens in Frank breach? Let me tell you that the hip joint is flexed and the knee joint is extended. Okay, so I have tried to make you, so it is wrong that hip is extended and knee is flexed. It is opposite. Hip is flexed and knee is extended. Okay, we will learn more in depth. EC is done after 34 weeks. Yes, it is done after completed 36 weeks. So yes, after 34 weeks it can also be that. Footling presentation, no. In Frank breech, only genitals present, mostly associated with congenital anomalies. After a short while, we will study that the breech is not associated with the congenital anomalies mostly. Sometimes it is associated, but not mostly. Okay, so you can see here, this is a Frank breech, and this breech is most common in. So here, this is the most common breech of all, and you can see here hip joints are flexed and knees are extended. Knee joint is extended. Okay, and next is here the this is the complete breech, where the hips are hip joint is flexed and the knees are also flexed. So all flexed is complete breech. Okay, complete breech means complete flexed. So whenever I am telling you complete flex, it means only two joints, hip joints and knee joints. It doesn't mean that if the breech has a stargazing sign, extended neck, then it is cannot be a complete breech. Yes, it is complete breech. That is a different problem. Now here it is a footling presentation. What is happening here? Here you can see here that the hip joint is partially flexed and the partially flexed or partially extended, and the knee joint is flexed. Okay, so because here there is a lot of space here in the footling presentation, so there is increased risk of cord prolapse. Okay. Okay, next here is incidence of. So I think you understand all the type of breach. Usually questions come on frank breach because frank breach is most common of all, and it is not that it is a footling presentation. In it, only genitals are presenting or buttocks are presenting, and in the case of complete breech, the both genital buttocks and the foots are presenting, and only foot is presenting in footling presentation. Okay, so next is incidence of breech at term is. So here I would like to tell you the etiology of the breech. What is the etiology of the breech? That cephalic presentation is much more common than breech presentation. Why is it so? Because in the case of the cephalic presentation, you all know that head is heavy than the buttocks. So out of gravity, the head comes down. I don't know why it is getting like this. Yeah, now it's okay. So you all know that the head is heavy than the buttocks, so head comes down at gravity. More so over the fundus is broad and buttocks is also broad. So it makes a perfect combination. Pelvis is small, so head comes down and out of gravity also. But sometimes because but when it is premature, the child is premature at 28 weeks, so there is a lot of space and child is very the fetus is very small at 28 weeks, and there is inside the uterus there is lot of space, lot of liquor. So when the baby kicks, so baby keeps on rotating, rotate, keeps on rotating. So at 28 weeks 30% of the fetuses they are breech, and at term only 3% of the fetus they remain breech, because at term there is less space, and so buttocks get fixed in the fundus and the head get fixed in the pelvis, which is less space. So here I would like to tell you that it is in premature if the baby fetus gets delivered at 28 weeks, then 30% chances are there that the fetus will be breech. Okay, so here you should know this thing very well, that most common cause of the breech delivery is the prematurity. Okay, now if there is any obstruction in the lower pelvis, then also there will be the breech presentation, because if for example there is low lying placenta, so placenta has occupied the space, so now there will be some dysrhythm, and all the findings will change now. Okay, and for example there is maternal uterine abnormality. If there is diadelphous fetus, then again malpresentation can happen. Okay, or there is any fetus anomaly. For example, uh, there is hydrocephalus, then the fetus head will get stuck in the fundal part, it cannot lodge there. Okay, and it cannot lodge there, there is no space. So of course the in hydrocephalic baby it is a breech presentation. Okay, but the most common cause is the prematurity. And incidence of breech presentation at term, this is a neat PG question. The answer is 3%. So this is again relevant because usually prematurity is the cause of the breech. So that is why they told ask this question to know that whether you know or that whether you are well familiar with this concept or not, that ki breech chances of breech are very less at term, or they are only 3%. Okay, now few words about brow presentation and face presentation. The brow in the brow presentation we do cesarean always, है ना? And on PV what we feel is supraorbital ridges, this supraorbital ridges and sinciput. We feel these two things on PV. Okay, so face presentation, in the case of face presentation, here I would like to tell you that there are two positions in the case of the face presentation. Okay, in the case of face presentation, there are two position. This mentum is, this chin is the denominator. Chin means mentum. Either the chin can be mento anterior or the chin can be mento posterior. So if it is mento posterior, then it has to, patient has to, fetus has to be delivered by cesarean. And if it is mento interior, then the a normal delivery can occur. Okay, so that was all about the breech, brow and the face presentation. I hope now you will be well familiar with the breech maneuvers. Thank you, have a nice day.